Hi, Candace.
Hi, Candace.
Hi, Dr. Brightman. Hi, Linda. How are you both this morning?
Fine,
We're well,
thank you.
thanks.
Thank you for joining me. You know, a new landmark study revealed that nearly half of women, 18 to 49, report having at least one accidental or unintended pregnancy. What can be done to reduce the rate of unplanned pregnancy in the U.S.?
I think women really need to realize that they are fertile, not take their fertility for granted, and be able to plan their families much in the way they plan their education and they plan their finances, and to discuss these issues with their healthcare providers when they come in for their visits, because their healthcare providers may not always raise this as a question.
And what surprised you most about the results of the survey?
Well, for me, one of the things that was disconcerting and surprising was that women were really minimizing their risk for having an unintended pregnancy. They didn't think that they could get pregnant. Maybe they thought they couldn't get pregnant because they didn't get pregnant the last time they had sex or unprotected sex. So that's one of the things. The other thing that we know from the data of the unintended pregnancy rate is that some women are just not using their contraceptive method correctly.
And how should women approach their physicians regarding contraception, and what questions should they ask?
I think women need to think about their individual needs, and Teva Women's Health sponsored this landmark study, and then they subsequently developed a guidebook which is accessible through whatwillyoudocampaign.com, a website where there's a downloadable guidebook where everything is explained, mechanisms of action for different types of contraception, as well as a list of questions so a patient can best decide which form of contraception is best for her, and then she can subsequently raise these questions with her healthcare provider.
And can you tell us more about the What Will You Do campaign?
Well, we're so excited that you're on the internet because they'll be able to access this quickly. The What Will You Do campaign.com is going to give them this downloadable a brochure on all the contraceptive methods. It's going to give them questions that they can ask their physician, but probably most important, some self-reflective questions. When do I want to get pregnant? What would happen to me? What will I do if I become accidentally pregnant? Women want to be proactive, I think. They want to be safe and be healthy. And, you know, sometimes they just haven't been using their contraception correctly or as efficiently or effectively as they could. I think women want to know, too, what's new. What's new out there for me? I've been on the pills for so many years. Maybe I'm ready to try something else. So using something like an intrauterine device, which has had a great resurgence and interest by many women and clinicians as well, as we're trying to bring that unintended pregnancy rate down.
And do you have any additional tips or information you'd like to share?
I think women need to realize that this is something that they need to take charge of. They also need to be aware of STD prevention, which is important. But contraception is very, very important. If they're using a method, it needs to be reliable, and they should make sure it's the right decision for them. You know, what are their goals with respect to getting pregnant in the near future, the distant future, or not at all? And these should all come into play prior to their, having a visit with their healthcare provider.
A woman's contraceptive care is as important as any other care that she takes care of herself. It's as important as taking care of her skin or her hair or any beauty products. Making a reproductive life plan using proper contraception will help her to be able to reach her life goals.
And where can viewers go for more information?
Well, we're going to hope that they'll go to the whatwillyoudocampaign.com.
Well, thank you both so much for joining me. I appreciate it. Have a great afternoon.
Thank you,
you
Candace.
too.
Thank you. Bye-bye.